Hey guys, how are you doing? My name is Omar Harmouche. I'm a DMD MPH candidate at Tufts. I'm a third year student. I'm recording these videos to share what it's like to be a dental student during the COVID times. Usually start off the day by reading a book, and for today, this is my workstation. It's not so big. This is my workstation, my coffee, my book, computer, some notes. Alright guys, so I just finished reading up the book that I had started. It's called The Lords of Strategy. It's about business consulting and the history of it and how it came to be. I realized it has nothing to do with dentistry, but I've been trying to read about the more business sides of things, about the personal growth aspect and about the business growth, just because they tie in to dentistry and to every field so much. Alright, so I've just finished writing up notes on single anterior implant placement. Okay, so I finished the notes on the anterior bite plane appliance, and see here, I'll usually leave those and then type them up the next day just so that I can get a refresher while I'm doing that. So I think the key that has been important in being a dental student during this coronavirus pandemic has been to remain positive and to stay dedicated to moving forward, not just remaining stagnant or just relaxing and watching Netflix. Just a little funny note, I wasn't bald before this. I actually had a lot of hair, and I had to make some sacrifices.
1, 2, 3, let's go. Let's roll.
Perfect.
Hey Omar, how are you?
I'm good. Thanks for asking. How are you, Dr. Abdul?
Very well. Thank you so much for taking the time to be here today. We really, really appreciate it. Now, you and your colleagues, you guys are the future of dentistry. It's you. You guys are going to be running the show in the future. So we want to take this opportunity to learn more about the dental student's perspective. So tell me a little bit about who you are, where you go to school, and a little bit about your background.
First off, it's my pleasure to do this interview. Thank you for having me. My name is Omar Harmouche. I'm a Tufts student. I'm doing both a DMD and an MPH degree at the school right now. And a little bit of background about myself. I was born and raised in Lebanon. I moved to the US around 10, 11 years ago. And it's been a lot of work since then. I started dental school. I'm a third year right now, and going through the whole COVID adjustments like everyone else is.
So what does it mean to be a DMD MPH student? What does that mean?
That means that I made the interesting choice of doing a dental degree and doing my doctorate in dental medicine and combining it with with a master's in public health, and to aim to graduate with both degrees at the same time. So it's just a joint degree program for a DMD and an MPH.
Is it 4 years? Is it a 4 year?
Well, it's supposed to be 4.5 to 5 years, but I think that I should be able to finish it in the 4 years. It's looking like I'll be able to graduate within the 4 years for both degrees, which is awesome. I'm glad that COVID doesn't seem to have affected that too much. I work very hard, so it's been paying off.
Is it a very competitive program to get in?
Honestly, it's not. So you get into it once you're in dental school already, and generally you have to get approvals from a few of the deans. They have to approve you depending on your grades and stuff like that. But I think any dental student in Tufts who is doing well in their grades, doing well in their well-being, and seems to be able to maintain the extra load, you can generally do it if you make that decision. And I think that it's been a very awesome decision that I made, and I'm very glad that I made the decision that I have.
Is there a specific career path that you would be expected to follow, having a DMD plus an MPH?
So I think it varies depending on the person. I think that having both degrees is a very door opening step. I personally did my MPH because I have this crazy dream about starting a nonprofit that helps children worldwide, and and I wanted to start a nationwide program. Start off by starting off a nationwide program in my home country to teach kids about health, teach kids about brushing their teeth, washing their hands, and just being overall more healthy. And I somehow got people in Lebanon to, say, I went to Lebanon and presented at the BIDM about my idea, and that's a Beirut International Dental Meeting, and I received a lot of support for it, and they said, if you want to do this, do it. And I was like, okay, I'm gonna do it. And I felt that I should get a master's in public health so I know what I'm doing while I do it.
So I remember being a dental student at Tufts. First year is very intensive. Second year was very intensive. Actually, third year was intensive. I guess every year is intensive. How does one throw in an MPH? So do you go through the regular classes and then at night you take MPH classes? How does that work?
I have to do a lot of schedule adjusting and a lot of planning to be able to do it. I try to be very organized with my time and try to plan everything according to both priority. So I have two different lists, and one list is by time and one list is by priority. And then I'll just work on both lists throughout the day. And that usually helps me like maintain all of it. Also, I wake up like really early. I'll wake up at around like 4 a.m. and usually I'll work till like 10, 11, 12 on some days. I know some days there isn't much sleep that happens, but overall, it's just being very organized, being very dedicated to what you want to do, and just driving forward with it.
So I'm sure this is on the top of everybody's minds right now, especially for a lot of us who's already graduated and those who have already graduated. Do you have to pay two sets of tuition?
It's a adjusted tuition. So they add the tuition to my dental degree, and it doesn't add too much. It's like maybe like 15K a year, I think. So it's not too bad to add the MPH degree. What I love is, and like actually that's been such a driver for me. So it's a set fee for the MPH. So no matter how many classes you take per semester, you pay the same amount. And that's gotten me to like, I'm like trying to finish my MPH courses by the fall so that I can take extra courses in the spring, right? So that I can like plan it ahead and like do as much as I can.
So before applying to dental school, you must have heard, and I'm sure you folks are a lot wiser than when I was a dental student. So you must have heard about the vast amounts of student loans that you will end up aggregating. You must know this. Mm-hmm. And you must have heard and done your homework about what the dental industry looks like right now. So the question is, knowing what you knew, you still applied and you still wanted to be a dentist. Can you tell us why?
It's a long story. My mom, when we were in Lebanon, used to always want us to be doctors from when we were kids, physicians specifically. And I was the rebel of the family. But we went along, we came to the US, it came to that American dream where we were all getting to where, we wanted to get to. And I did not like medicine. I started shadowing a dentist, started looking into the dental field, and I absolutely fell in love. I think that we have the best field to ever exist. I love dentistry so much, and I'm so glad that I'm here and I'm at Tufts. I did not even consider the loans and the fees aspect of it before coming in. I always knew that that's just something that we're gonna have to figure out. And no matter what career, as long as you're happy with it and as long as you're good at what you do, it shouldn't matter what investment you're putting in your education. You're making an investment, and that investment is going to pay off depending on how well you apply it. So I think that like I I still till now don't even think about that. I just think that work work as hard as you can, learn as much as you can, apply it when you graduate, and everything's going to be okay. You know.
That's a fantastic answer, but I will have to push you a little bit on this a little further.
hmm
Where did you go to undergrad?
University of Houston.
Okay, and what did you study?
I studied biology.
So when we're all said and done, do you know approximately how much you will have in student loans?
I mean, and for me, I have a unique situation where my parents are gonna be helping out me pay them as I go along. But I'm assuming I'll graduate with around 400 or 500 grand.
Now, what do you for all those of us who've graduated a long time ago, um, what does that mean in terms of monthly payments?
That means, well, it can mean a lot of different things, right? Because we have to refinance our loans, right? And we can refinance at a certain monthly payment, whether we're putting the interest first or whether we're putting the payment first. So if we want to get rid of the loan as quickly as possible, or if we want to, have it on a longer duration. I think a lot of us really have had to accept loans as a way of life, and it's just become something that we just gotta gotta deal with, regardless of you know what we think of them or where we see them.
So you mentioned that you're originally from Lebanon. Uh, is education there free? If had you gone to dental school there, what would you have paid?
It would have been variable. I know the public schools there are very, very cheap. They're also very, very difficult to get into. I know my friend is applying to medical school there currently, and it's around like one-fourth the price, maybe, of schools here. One-fourth to one-third of the price of the schools here, and it's still a lot, but it's not nearly as much.
Since you mentioned, one fourth, what is the current tuition for Tufts?
Well, uh, it's around $80,000 for the MPH, and then add another 10 to 15K for the MPH. So around three figures.
And how much are living expenses? Boston is not a cheap
No,
city.
I live in a very small apartment in Chinatown, and I pay $1,800 of rent a month. It's a lot, and my apartment is not nice. I will tell you that much. Not even a little bit. I had to move in with my friends so I don't have to deal with it, right? Because usually it's where I go to sleep. But it's a lot. It's $1,800 a month, and you're not even living that comfortably. So I can only assume as you graduate and you want to live in a nicer place, and you're not living as a student anymore, I can only assume what that implication has. As to the food, I have a system. My dad comes in every few months. We bought a freezer in my house. I have a grocery store in my apartment, and we just go to Sam's in New Hampshire, and we fill up everything. And that's been like my system for it. It's still expensive though. It's a lot. It's a very expensive city to live in.
Now, I'm going to move on to a little bit to the next aspect of this. For a lot of us thinking about public health, for those who are thinking about specialization, does the volume of student debt you have aggregated, does that affect your decision in terms of whether you can get into public health or not? I know you talk about the project that you're planning on doing in Lebanon. Will this student loan impact whether you can do the project? Have you thought about specializing?
I personally have always been a fan of not specializing. A part of me wanted to do oral maxillofacial surgery originally, um, but I came to the decision that I just love general dentistry so much, and I think like I said, I think it's the best field in the world, and I have like my reasons for saying that. I don't just say that. It combines it combines everything you could want in a field into one, and I don't think that there's much that you can take away from that. Um, but for uh, for specialty or doing a residency, I haven't thought about doing a residency now with the COVID. I'm certainly maybe reconsidering that, but I always thought of it as no matter where I go, once I'm in the real world, I'm going to have to get my practice back up. So for now, what I'm going to be doing is working as much as I can, doing as much clinicals as I can. I don't even look at requirements and points for that much. I know what's the bare minimum, but I'm not. That's by far not what I'm trying to do. I try to live my life as if I'm already a dentist, or as if I have 2 years to be a dentist, and those 2 years I better, be hustling as much as I can. And once I graduate, find a good mentor, work with a good mentor, learn from there, do some CE courses on anything that I don't know, and keep moving forward with it.
You mentioned that with COVID-19, and we might be jumping a little ahead, it has made you consider specializing. Is that what you said?
Yeah, it's made me consider doing a GPR or doing some sort of residency program. I I still, I was doing pretty well before this whole thing happened, and now I haven't been in clinic in more than a month. I'm probably not going to be in clinic for another month. That has a lot of an effect on you as a student, because once we start up in clinic, there's like you have to get the ball rolling and then you're driving forward, right? But like we're all got the ball rolling, started driving forward, and then the ball was thrown off course. So then now we've got to get it rolling again. So I definitely think that might have an impact on everything.
Will this delay your graduation? And could you tell us a little bit about how Tufts is helping you out in terms of managing this current crisis, this situation?
Yeah, I think that overall they're doing everything that they can to accommodate, changing some of the graduation requirements, changing some of the systems in place. I know they're considering having Saturday and Sunday clinic open for us to be working on Saturdays and Sundays once this thing is over. I do know that they're putting our safety first ahead of everything, and that has its impacts. I know that personally, I have my reservations about changing clinical requirements, but also I understand that we all have to graduate. So it's it's a lot. I think that our class it's not going to affect us as much as maybe some of the fourth years. I think with our class, with accommodations and with them, once we get started back up, finding out who are the students that need the most help and helping them out, and just making sure we'll all still graduate. And I think like long term, we should be okay. But it's just something that is a bit of it's just not something that any of us expected, So
If you were to not graduate on time, and speaking for your classmates that are in the fourth year, are arrangements being made so that there's going to be they won't have to pay any additional tuition or things like that being done?
not according to my knowledge. Not according to my knowledge. I believe that I got an email today saying that if you're expecting to stay past May, you should file your financial aid. That way, if you need it, you'll still keep it. So I don't know. I do know that they've made a lot of clinical adjustments, and trying to do everything they can.
Is that the same thing that's being done at Harvard or Tufts? I mean, Harvard or BU? Are you aware what they're doing differently?
I have no idea. I've been working a lot and not been socializing that much. So I'm not sure. I have no idea what those schools are doing.
So the future, hopefully for dentistry, is still bright, but we are definitely going to have some changes. Beside potentially doing a GPR, what were your plans before COVID-19? Were you thinking of coming out, starting your own practice, coming out working as an associate? What were your dreams then, and what is it now?
Before COVID-19, I was actually considering the idea of moving all the way to Saudi Arabia to do work there and to get started there. Post COVID-19, I don't think that is going to happen. I think that I cannot be taking, because, moving to a new country is a risk, right? But you can't take a risk during an already risky time. So I had to kind of back away a little bit from that. I'm starting to think, I'll graduate, I'll start working in a in a group practice for a year or two, make sure I know what I'm doing, and then make a decision from there where I move forward, because I don't want to go somewhere without knowing what I'm doing first. So that's just been something that I had to reassess. I mean, which is like a huge thing to reassess too, because you're changing your life track, but
So two questions there. Number one is, in the United States, access to care, access to dental care is still compromised in certain part of the country. What would lead somebody like you, highly skilled, highly educated, what would lead you to want to leave and go work somewhere else? And secondarily, now that you're not going, tell us your prospects. I mean, what does the job market for dentists like yourself, what does that look like?
I think that for both, for both answers will kind of tie in. The reason that I wanted to move to the Middle East, I was thinking either Saudi or Dubai, but Dubai had some licensure requirements that I would have had to delay things on. So I decided, maybe Saudi or somewhere else. And, Saudi was the one that I was looking at. Is mainly I just wanted to be closer to Lebanon because of my project. I just, it's something that I'm actually driving forward in dental school, and I should be piloting in August with a lesson plans book for classes, and with toothbrushes, toothpaste. We have a little system that we've been working on for a while, and we still plan to implement it starting in August. We've just had to shift some of the ways that we're going to be implementing. That way we don't have to deal with the COVID issues. But for as to having to move here and to stay here and how that's affected everything, I think that has just been talking with my partners and just trying to figure out how are we going to make this to be the best thing that I love reading books, and there's this book that I read a while ago, and it says you have to, whenever you hit an obstacle, you have to think, how do I make this the best thing that's ever happened to me? And it's just, okay, now that we're in this position, how do we make this like the best thing that's ever happened to us? And I think that we came up with a pretty good shift that we should be releasing in like a few days, that I think that should make our nonprofit initiatives move at a lot faster rate than we planned originally as well. And we'll still have the dental, I'm still going to be finishing up dental school, working in the US. I think that job prospects in the US, I think it's always going to be easy to find a job as a dentist. I think that when you're a dentist and you're a competent dentist that is doing all they can to help people, and you genuinely care about the people, you shouldn't have a problem finding patients. People are always going to, it's a field that people are always going to need. So, I'm not too worried about it. It's just been a lot of shifts that we've had to make in a very short time.
Now, serving on the Mass Dental Society, I hear a lot about the challenges for your fourth year getting, doing live patient exams, doing exams on patients. I want to hear your perspective. Tell us a little bit about, there may be non-dentists watching this as well. Tell us a little bit about live dentist examination. What does that mean?
So basically, the live patient exam is an exam that dentists take, and we're the only field that does a live patient, and you take this exam on them, and that exam determines whether you're going to be a dentist or not. In theory, doesn't sound too bad. You're working on a patient, you see what happens, and you move forward. An application, it is not exactly ideal. Okay. First off, the student has so much pressure of just finding the patient that your you're graduating as a dentist becomes a matter of, am I going to find a patient or not a matter of, am I a competent dentist, which I think is like a huge problem. And another aspect of it is when like there's a certain requirement of a lesion that can qualify, and sometimes it becomes a matter of like, is it really the best treatment, or is it what needs to be done to have a patient? And it's a very broken system that sounds good in theory, but in application just does not work. And I think that I know that we're starting to move away from it. I think that maybe the COVID-19 scenario had something to do with us moving forward at a little faster rate than we were originally, and I'm like so thankful for that, because it's students shouldn't be worried about finding a patient to graduate. You should be worried about getting your skills up to par, getting your skills ready so that you can become a good dentist. Your main stress in dental school shouldn't be, can I find a patient? It should be, how do I become the best dentist?
Omar, so I'm going to take my dentist hat on and ask you a question as if I've never done this. So how is this ethical to bring a patient in and do an exam, a surgical procedure on a patient, and assess whether you pass or fail? I mean, how is that even ethical? Can you tell us about the ethical aspects of this?
I think that it's a dilemma. I have mixed feelings about this part of it. Personally, I feel that as dental students, we do work on patients. So then, but it's like, it makes it so that we work on patients regardless, and I think that every dental student is capable of working on patients. If they have a day that's bad, then that's wrong. But I think that aspect of it, as dental students, we should be able to confidently work on a patient, because at that point we've been doing it for 2 years. You know what I mean? So like that's like my personal view on it.
Do cardiac surgeons, do thoracic surgeons, do they have competency tests like this on live patients? Does that happen?
No, they do not. We're the only field that they do it. So like, I have some medical student friends, and that's where like it becomes a bit of a. Here's where the issue is. Okay, so, or at least where I see the issue is, as a medical student, you're going to be dealing with patients, right? But those patients don't have something that's specific that needs to be treated. They're coming in, and you're finding out their diagnosis, and then their treatment is X, Y, or Z, right? And the medical exams are a fake patient that comes in, and you have a conversation with them, and you do whatever you need to do. But with dentistry, a lot of the patients that come into us, the diagnosis is caries, or it's a more limited scope of diagnoses, right? So then it becomes a matter of like, how do we you know what I mean? Like, how do we apply it? How do we test? Because we could do an exam, which, I mean, we do the board exams to determine the knowledge aspect of it, but we are also working with our hands. And I don't know, personally, when I came in, the system existed, so I might be a little I might be a little bit like, I've just accepted it for the way, like, I just accepted it the way that it is. But I see a lot of, the main concern for me is just the fact that as a dental student, you should be focused on being the best dentist, okay? You shouldn't be focused on, how do I pass an exam, or how do I find an exam how do I find a patient to be able to pass an exam. You shouldn't have, weeks and months of just being frantically searching for patients, who a lot of patients also, like, there's the whole controversy of like patients asking dental students to pay them, right? Or another thing that's a big issue for me is that the licensure is only satisfactory in certain states. because that's, if you're a competent dentist in one state, you're a competent dentist in another state. That doesn't that doesn't add up,
I completely
But
agree with you, Omar. But now let's shift again. So, us older folks, us with the uh, Massachusetts Dental Society, us with the American Dental Association, we want to help the next generation of dentists. That's what we want to do. So many of our viewers are going to be part of organized dentistries, a variety of organizations. Tell us, what should we be doing? What should we be fighting for to make your lives better, and also for you to be able to pursue your dreams, whether public health or private dentistry? What should we be doing? What should we be fighting for to help you folks out?
I think the main one is figuring out, the loans issue. I don't think that it's very easy to graduate $500,000 in debt. I think that we're in a great profession, and that's why, I personally don't worry about it, because I just, we're in a great profession and we're going to be fine. But that's a very hefty sum. And when I say that out of a place of optimism, right? Like, I might graduate and be like, it's not fine, I was wrong. I was very wrong. But where the issue, I think that's one of the biggest things. I think that having the licensure exams be relevant across all 50 states, having a licensure exam that doesn't make the students have the pressure of, oh my God, I need to find a patient. Oh my God, my patient dropped yesterday and I don't have a patient for tomorrow. And I'm like losing my mind. I'm about to cry. I've asked everyone and I can't find one. Please help me. Because I've had these conversations, and it's insane. There should not be that kind of pressure on a student. That's just unfair. So I think that, figuring out how to make the licensure easier for us, how to make the licensure comprehensive so that we can go to other states, the student loans aspect of it. I also think that there should be more of an emphasis in dental schools on, and I think that Tufts has been doing a great job of this. They've been, improving it every year, and we're constantly learning new things on the business side of things, on running an office, on how to do these things, on wellness, on being able to do our job healthily, ergonomics, these things that aren't just cut and dry dentistry. These things, the non-scientific aspects of it, are a very, very big part of what we do. And I think just having starting to have more of an emphasis on those as well as we move forward, I think that that's absolutely crucial.
Omar, what makes you happy?
Honestly, a lot of things. Dentistry makes me happy. I love my field. I love my job. I love my patients. I think that one of my favorite things to do ever. And I have one of my mentors and professors at Tufts, Dr. Rubin, and I always wear a suit and a tie because of him, right? And I hope he sees this. And
I'm sure he will.
One of my favorite things every day is to wake up, put on my suit, and go and meet my patient. Just that first few seconds of saying hi to my patient, shaking their hand, which is going to be taken away from me because I can't shake their hand or wear what I currently wear, because now I have to, wear all the PPE and limit the handshaking. But I think that makes me so happy. I think that doing something that actually contributes to society, helping out, the universe, serving the universe, serving your purpose, and just doing everything you can to be the best person that you were intended to be. I think that that's what makes me happy. Just waking up every day and just knowing that, if you want to be the person that you want to be, all you have to do is do it. All you have to do is apply it, work through it, and keep driving forward. And I think that that's so wholesome, right? And no matter what you want in life, all you have to do is just get up and do it. And I think that that's what makes me happy. That's at the core of it.
Omar, it's so refreshing to speak to a young mind and to see how bright our future is going to be. But before we end, I want to thank you for recruiting. Literally over 100 physicians have contacted us because of your efforts to join Dental Cupid. But I don't want to talk about Dental Cupid. I want to talk about your project, the project that you are having in Lebanon. So, I want you to give us a summary so everybody can learn a little bit more about it. And finally, also tell us, how can we help you?
Okay, so there's and thank you so much for mentioning my project. I love my project. My project is my baby. I've been working on this project for years, and it's been my dream to do this project since I was 11 years old, since the day that I moved to the US. They can read my personal statement, they will know, and my project basically focuses on bringing health equity to children. At the beginning, it was just Lebanon. Now it's health equity in children worldwide through a system that combines health education through lesson plans that are based on a needs-based assessment. So in Lebanon, this is nutrition, smoking, because Lebanon has the third highest smoking rate in the world, uh, uh, oral and general health, and oral and general hygiene, and teaching kids the fundamentals of health, right? And we combine that with a health promotion program that is toothbrushing and hand washing, and everything that associated, so flossing as well. So what we've done is we've developed lesson plans for grade levels from kindergarten to the 5th grade, and we've developed these custom boxes that we give to each child. And we have this protocol that we deliver to a school, and all they have to do is implement the protocol. And it's a very simple protocol. We've kept all the lessons to less than 10 minutes, planned it for 2 10-minute lesson plans a week. And through the protocol, we teach kids how to brush their teeth, how to wash their hands, and they do so in the school, right? We've made it so that everything that we do is eco-degradable. I know we're expanding our brand. In literally the coming days, we're going to be releasing a variation of a DBA from One Lebanon, which is, and I don't know if my partner will get mad at me, but it should be released in a few days, and it's called Box for Health. And it's literally like a small box that we use to deliver to kids, and we deliver it through schools in developing countries, and we just make sure that kids know how to stay healthy. It's very limiting on a child to not know how to be healthy, to not know the habits to be a healthy and successful person. In Lebanon, for example, children between 12 and 15 have a 60% rate of having had tried some form of tobacco, and that's children 12 to 15. In the U.S., we have issues as well. We have like certain areas where there's a very high decay rate. There are certain areas that I've been surprised by the things that I see, especially because like of the public health program. Before I started the public health program, I didn't see these discrepancies and these inequities. It was something that I thought, I came in as an immigrant from Lebanon, so I always thought, oh, the U.S. is the best thing ever. And then you look at the U.S. and you look at the details of it, and you're like, we can definitely do some improvement. There's definitely a lot of places that we need to help improve. But the idea of the company is to serve children and to help achieve worldwide health equity through education, and through something that's so simple that can be implemented by anyone. We just need to deliver them the products. I think that what people can do to help is look us up. Look up onelebanon.org. Donate. I know right now we're starting to open up Box for Health. We're having some issues with the Chinese manufacturers for the boxes. We're going to be selling boxes that are the same boxes that we deliver to children. Everything is made from bamboo and biodegradable products. The toothpaste are tablets, not toothpaste tubes, because the toothpaste tubes have plastic, so we're trying to be sustainable. We'll make sure that the toothpaste tablets have fluoride in them, and just check it out, look at it. I'm sure that there's a lot of ways that people can help. I'm sure that in the future we're going to want to expand to delivering dental care too, maybe partnering up with mission trips and such things. And that's really what we've been driving towards. So
this sounds fantastic. Are you working with the World Health Organization at all?
Not yet. We were selected by the Clinton Global Initiative University Incubator Program for our work, and they have been very supportive, and they've pushed us a lot during everything. I know we were supposed to go to Scotland and be with all these different great minds, and the COVID-19 happened. So that's been delayed till next year. But I think that it's been great. It's been an amazing journey.
Well, if it's okay with you, I will be posting your contact information at the bottom of this interview, and also a link if you can provide me, so that we can donate to your program. Because it's important we do that.
I would absolutely love to. I'd absolutely love that. Thank you so much, Doctor.
Omar, thank you so much for your time. And once again, very proud of the work that you have done and you're going to continue to do. And listening to you makes me feel that there is a tremendous future for our profession. And thank you again. And we look forward to getting you back here and getting another interview soon. Thank you again. Have a wonderful night.
Thank you so much, Doctor. You too. Goodbye.
I think that overall, just looking to the future, it's going to be really good, and I'm very excited.